Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. I shall be talking on atherosclerosis and CAC. What to do? What do you do? Especially when it is a known fact that to get the early onsets of any disease, that is, if you want to diagnose the early onset of any condition or diseases, you need to have a laboratory test, whether the laboratory marker test or other laboratory test that pinpoints the onset. The other diagnostic tests usually are done after the manifestation internally, that is the physical deformity. You can see a physical appearance. But at the micro level, the microcosm, that is where the laboratory scientists, the medical laboratory scientists, really play a very good part in making sure that that onset is nipped in the bud. And in this kind of situation, you have atherosclerosis and CAC, that is coronary artery calcium. The two conditions are not what you can discover using the same laboratory method. But the coronary artery calcium can only be discovered or really graded to expose the cardiovascular risk, that is the likelihood of having stroke, experiencing stroke, heart attack, and all these dangerous conditions that you don't want. I don't wish even for my enemy. Is the CAC. But before you are doing, or you will be doing CAC, the condition, the atherosclerosis has really been established. So atherosclerosis establishment needs the laboratory investigation. So you can monitor atherosclerosis by doing lipid profiles and kidney function tests. Your parathyroid will also be useful for your calcium level and all the other calcium estimation tests that you could do. But that is to prevent atherosclerosis or the level at which it is. But like I've always said, I cannot download everything. If we want more information, let us move on to the slide section. As usual, press the like button, subscribe, and more information, more knowledge will be acquired by you to keep healthy, to overcome this stroke and cardiac arrest and all the problems that are associated with cardiovascular diseases. The outline: objective introduction, atherosclerosis processes, what to do, diagnosis, and finally treatment. The objective: to expose the knowledge of atherosclerosis and coronary artery calcium in order to know what to do to prevent the onset of the disease and the confirmatory diagnostic choices available for an effective treatment. The introduction: this video is on what to do about atherosclerosis and coronary artery calcium. We need to define what these are. Atherosclerosis is about plaque formation in the arteries. What type of artery are we talking about? The coronary artery, which is the artery that supplies the heart nutrient and oxygen. While coronary artery calcium is the hardening of the plaque by calcium. The practice is the atherosclerosis comes first before the coronary artery calcium. Atherosclerosis is affecting over 40% of middle-aged individuals and no known heart disease, and its prevalence increases significantly with age and risk factor. Over time, these plaque hardens and eventually calcify, leading to serious consequences of coronary artery calcium from calcium deposits. So that, in a nutshell, is more or less telling us that the coronary artery calcium comes last. Now to the process of this plaque formation. Atherosclerosis starts from the buildup of fats, cholesterol, and other substances in the artery. These substances also include platelets from the inflammation and problem. The overindulgence in food intake creates excess fats that is stored away and eventually in the arteries as seen in this diagram. You can see that when you take too much fat, you are more or less loading the passage and narrowing the passage of the blood flow. The abnormal buildup of calcium from the areas for the formation of bones and teeth as a result of injury, inflammation, age, hyperparathyroidism, etc. can lead to calcification of the calcium in the arteries and other tissues. We know that once you look at, when you look at the teeth, the bones, you see that they are made up of mineral substances, not living cells. So even when you want to find DNA in them, you cannot. The presence of calcium is evidence of advanced atherosclerosis and indicates that damage to the artery has occurred and been repaired. The amount of calcium measured by a CAC score is a direct indicator of how much atherosclerosis is likely present and help predict future risk, though the calcium itself isn't the direct problem. What do we do about, from what we have gathered so far? From the knowledge acquired, what we can do is to stop overindulgence in heavy calories food. That is, when you overeat, you now store this food as fat. So that indulgence can create that atherosclerosis. Indulge in regular exercises to burn fats. Avoid unnecessary injury. The injury creates platelets that can also block it, especially internal ones. Monitor your calcium level, the parathyroid hormone. Drink enough water to reduce calcium salt. You can stop aging. You can't stop aging, one of the risk factors. Now to diagnosis. When we talk about diagnosis, not only laboratory diagnosis, since the CT scan too is very useful for the coronary artery calcium. It will give the score. Once the score of the CT scan for calcium is above 0, then you start thinking of experiencing stroke in such a person. But the basic truth is that without the atherosclerosis, there is no coronary artery calcium. So the laboratory concern, which I have competence in, is to do the blood test, detect blood calcium so that you know the level, and once it's getting too high, the cause of the high level is what you could confirm, but once it's too much, it will classify the calcium. Lipid provide test to maintain the normal level for the cholesterol, the triglyceride, especially those who overindulge in food, kidney function test, liver function test, parathyroid hormone test, calcitonin, and any other blood marker test, including the platelets. Once it's aggregating too much, the platelets, once they aggregate, especially when there is injury, which is part of the cause of the blockage of the arteries, you need to be concerned too. Finally, treatment. Prevention and treatment strategies for atherosclerosis and coronary artery calcium is the strategy to really prevent it, just like we started with what to do. So you prevent overweight, and that's what we can do, and obesity. We prevent calcification from elevated blood calcium. When you do the blood calcium estimate and you are finding it high, you need to bring it down. Monitoring and lifestyle changes. You monitor certain values, both for the cholesterol, atherosclerosis, and for calcium as well, especially smoking hardens the arteries. That is also very instructive. Prevent or treat hypertension and diabetes, especially by doing exercises. So exercise is recommended. Physical exercise. Increasing fluid intake to flush excess calcium from the body. Medications. Cholesterol-lowering drug, antiplatelets, anticoagulants bypass surgery to open blocked arteries and improve blood flow. One or just several things that could be done. The list is not ended here. It's endless. Bisphosphonates is another one. These drugs can lower calcium level quickly, especially in cases related to cancers. The cancer is another problem that can cause this coronary artery calcium. Calcitonin, this hormone, can help regulate calcium level. Calcimimetics, this medication can help control overactive parathyroid gland. Surgery. In cases of primary hyperthyroidism, removing the affected parathyroid gland can resolve the issue. This is my 205th or 5 video on health matters. You can always gather more knowledge. We all share knowledge. I am gaining knowledge by doing extra to inform and educate ourselves, and you to gather more. Click the like button, subscribe for more quality production. Thank you.